Good afternoon, everyone here, and welcome to the second lecture of week 2 of the certificate course that is Law and Alternative Sexualities. Today, we have very interesting session, especially those who are really very desperate and they have interest to know about the mental health. So, the topic that we have today is developmental perspective of sexuality from a mental health professional, Dr. Anagha Karve, Joag, consultant psychiatrist at IPH, that is Institute of Psychological Health, Pune. Dr. Anagha Jo Karve, she has completed her MBBS from Goa Medical College and her post-graduation from the Institute of Psychiatry and Human Behavior in Goa. She has been a practicing psychiatrist for the last 9 years with a special interest into geriatric psychiatry. She has also worked She has also worked at Somaya Hospital in Mumbai for about 2 years before moving to Pune, and she has been working with Institute of Psychological Health Pune since 2019, and also associated with Tapas Geriatric Care Private Limited, which offers residential care for elderly suffering from dementia and other psychological issues. For to know more about Dr. Anagha Jog, I would request one of our participants, Sanvi Sai, to introduce our today's guest. Over to you, Sanvi.
Uh, Good afternoon, everyone. Dr. Anagha Joag has completed her MBBS from Goa Medical College and post-graduation from the Institute of Psychiatry and Human Behavior in Goa. She has been a practicing psychiatrist for the last 9 years with a special interest in geriatric psychiatry, and she's worked at Somaya Hospital in Mumbai for 2 years before moving to Pune. She is currently working with the Institute for Psychological Health IPH Pune since 2019, and she's associated with Tapas Geriatric Care Private Limited, which offers residential care for the elderly suffering from dementia and other psychological issues. We look forward to this lecture, ma'am. Over to you now.
Thank you. Thank you. Thank you so much for the kind introduction. So, do I start presenting?
Please go ahead, Dr.
Yes.
Anagha.
Yes. 1 second. Okay, is my screen visible?
Yes.
Okay, all right. So great. Okay, thank you for those kind words and good afternoon, everybody. So today, my session is going to be in two parts actually. First, I will be covering the developmental perspectives of sexuality, and thereafter, we will learn how to deal with family members. All right. So to begin with, before I start, I would just like to confirm that I think we have a question answer session scheduled at the end of both of my presentations. From my side, I would like to tell you that if at any time you feel you have any question popping up in your mind, feel free to even type it into the chat box and maybe we can address them later. Also, if at all in between you have some kind of a doubt, any of you, and you feel that without clearing it you won't be able to understand the rest of the PPT, you can unmute and interrupt me in between also, okay? Because it's important to understand some of these concepts. So if at all, if you feel that your question is such that it needs to be addressed before you can understand the rest of it, then you can unmute and ask me in between as well. All right. So to begin, we will, I think, start with understanding what is the difference between sex and gender. So when you say sex, we refer to biological sex, which refers to the anatomy basically. So the reproductive organs that a particular individual is born with. Whereas gender is more the awareness or the sense of being masculine or feminine in a social context. So gender is more psychologically and socially defined, while sex is a biological or an anatomical definition. Now, most cultures use gender binary, right? So we have two genders, either male, female, masculine, feminine. So those who fall outside this category are sort of grouped under the umbrella term of non-binary or gender queer. Now, again, I'm not going to go into all the definitions of all the subtypes that come under non-binary or gender queer because I understand this has been covered for you in some of your previous lectures. So we starting with development. So development always starts with a sense of self, right? So where does the sense of self emerge? It starts, in fact, right from infancy, almost from the time of birth, and goes on to develop until about 1 to 1.5 years of age. Now, it always begins or emerges in the context of and in response to the infant caregiver relationship, right? So, this sense of self is based on initially sensory experiences. So, an infant feels hungry, tired, sleepy, so the infant is going to make its needs known by crying generally. And depending on the kind of response or the care that it receives from the caregiver, he or she, this infant, bases some emotions, right? An emotional attachment happens between the caregiver and the infant, and it is this emotional connection to the responses which forms that which is important for the growing development of self, right? So this initial concept of self is very rudimentary. In the first few months of life, it is extremely rudimentary. Gradually, from the fifth month of life onwards, a sense of self efficacy develops, which means a sense of being able to master challenges and achieve goals. For example, a 6, 7 month old baby will push a ball and see it move. So he begins to realize, oh, I made that happen. So I can make some things happen. This is that sense of self efficacy, and it begins around that age. As the sense of self efficacy increases and heightens, a sense of self awareness sets in, which means this infant now starts seeing himself as a distinct and identifiable being. So, self from others, right? It's around the age of 10 months onwards that this very distinct sense of self awareness starts setting in. And as the child grows older, this sense of self awareness heightens. And then the child is able to distinguish between I and you. The I self and the me self, so to speak, develops. Now, gender identity also is an important aspect of this very developing self. Gender identity is defined as self identification through self experience as a male, female, both, or neither. So, it is the awareness of one's maleness and of femaleness, again, in a social context, right? So gender identity is subjective. What I feel, do I feel masculine, do I feel feminine, irrespective of my biological sex and in a social context, as opposed to gender differences, which refer to observable behavioral differences between males and females, right? So gender differences are observable, objective. Gender identity is a subjective concept. Now, what are some of these differences, right, between male and female patterns of behavior? So again, in infancy, in very early childhood, the differences are not very observable. For example, whether it's a boy baby or a girl baby, they will start to crawl, sit, stand, walk, teeth at more or less the same time, right? So there are very few observable differences around that age. Significant differences start being seen around the preschool age, and the most important one of them is the presence of overt aggression, which is much more in males than in females, and this aggression is verbal and physical. All right, so boys are seen to be more overtly aggressive as compared to girls until the age of, say, about 6 years old. After 6 years, this aggressive tendencies in girls tends to fall very rapidly. So girls then, over a period of time, are more compliant. They seem to be, more empathic. They seek adult approval more, as compared to boys, in whom this aggression sort of goes on unchecked, right, until later childhood and puberty as well. Now, what can be some of the reasons behind these differences? Why these gender differences in girls and boys? So, as with any human or biological trait, there is always a biological basis and a psychosocial basis. So, inherently, biological basis could be, girls tend to have higher frustration tolerance, they are better at communicating, while psychosocially speaking, girls and boys are socialized differently. Girls are taught from a very early age to control their impulses, to share more, to think of others before thinking of themselves. So both of these sort of come together and play a role. So looking at each one of them in a bit of detail, we'll go to the biological aspect. So what could be the biological basis for gender differences? So when brain studies were done between males and females, girls and boys, it was noticed that there is a size difference in the corpus callosum between girls and boys. So what is the corpus callosum? Our brain, as all of us know, has a right hemisphere and a left hemisphere, and there is a band of tissues, nerve cells, etc., that connects these two hemispheres. And this band is called the corpus callosum. In females, it was seen that this corpus callosum is denser, right? So the density of neurons, of fibers, of tissues, of interlinkages between the two is much more in girls than in boys. So this could also explain better coordination between the two hemispheres in girls. It is also related to superior verbal ability. So girls are seen to be better able to communicate their emotions, to work through their emotions as compared to boys. There are also hormonal differences between girls and boys. So testosterone, which is the male sexual hormone, is obviously in higher levels in males, and accompanied with slightly lower levels of serotonin, which is another neurochemical. This combination, it relates to greater levels of aggressiveness, competitiveness, and dominance in boys, which are common traits that we see now amongst men or males in general. Now, gender identity could also be rooted in chromosomal structure or prenatal development. So there's a very interesting study which was done on this baby boy, and when I say boy, I mean who was born biologically male, right, with the male sexual organs, who suffered a penile injury at the age of 7 months. Mind you, that's a very young age, 7 months, which led to an accidental cutting of the penis actually. So at this point, along with the family members and the doctors consulted, and the family decided that they wanted to raise this child as female. Since some kind of sexual reconstruction had to be done, they decided they wanted to raise this child as female. So sex reconstruction surgery was done. All of this was complete between 1.5 to 2 years of age. So a fairly early age for any kind of psychosocial impact to begin, right? Generally, this starts a little bit later. After that, the child was reared female. So when I say reared female, as all girls are raised in terms of dressing, clothing, etc., etc. Around the time of puberty, however, this child was seen to reject the female identity and then switched on to living as a male for the rest of his life, her life, his life. So this shows that gender identity is in our very DNA, and it cannot be easily changed. So just by rearing a person in a particular identity, in a particular gender, or even sex reconstruction surgeries is not going to so easily change the gender identity. So some kind of strong biological basis, genetic basis, chromosomal DNA basis is there for gender identity as well. As the biological aspect, there is always a psychosocial aspect as well to any trait. So here there are three aspects actually. There are three concepts which are gender role, gender stereotypes, and gender typing. So gender roles refer to the behaviors, interests, attitudes, personality traits, skills that a culture considers appropriate for males and females. So very culture based. Huh? Gender roles is very embedded in culture. So all societies have gender roles, not just our Indian society, Western, etc. Everybody has some fixed roles for what a girl should do, what a boy should do, how he should behave. What are the hobbies that he or she should have. So, I mean, all of us can think of multiple examples, can't we? If anybody wants to share any examples of gender roles, I can start off maybe that girls are expected to, learn to cook, help around the house, do more chores than boys are within the same family as well. Uh, Anything else? Is anybody uh, willing to give some examples, or should I move on?
Girls are supposed to serve while men just sit back.
Absolutely, absolutely. Anybody else?
Somebody has written play with the dolls.
Yes, 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 indeed. What they should do exactly, play, the kind of playmates, right? All of these things are very, very culture based to a large extent, right? And culture sets those rules, like what should all girls and boys, and what should they do, and how should they be. So multiple examples I'm sure all of us can think of. Gender typing is the process by which children learn and acquire those gender roles, right? The process as to how this happens, again, starts very early in childhood. It can start by, it starts from home only, parents, their neighbors, teachers, etc. So it begins early in childhood, but interestingly, children can vary in the degree to which they become gender typed. So you see, although the same kind of influences upon a particular group of children, not all of them will accept these particular gender roles as easily, right? So some may acquire, and some may, sort of follow those particular roles, whereas some may rebel against them. So the process by which this happens is called typing. The degree to which each child goes on to become gender typed can vary. And lastly, gender stereotypes. Now, gender stereotypes are preconceived generalizations about male female behavior. So, sort of overlapping on gender roles, again, present in all cultures, children as early as preschoolers. So, stereotypes would be exactly that, right? That girls playing with dolls, boys should play with toys, trucks, whatever. Mechano sets or things like that. So these are certain, and of course there are so many preconceptions, aren't there, that what should boys do and what should girls do. And this starts, as I said, from preschoolers. So 2 3 4 years is when these things will begin, and they go on. Really, there's no really end point for all of this stereotyping and gender typing that goes on. Another theory that was postulated by Lawrence Kohlberg was called gender constancy, wherein he postulated that children first adopt a particular gender. So they see themselves or classify themselves as male or female, and then they organize the rest of their behavior around it. Right. So he postulated that gender constancy can develop in 3 stages. The first stage is where they become aware of their own gender, right? That yes, I'm male, I'm female, and that of others as well. Secondly, they tend to realize then with time that I'm going to permanently remain male or female, which means a boy child will realize that I'm going to grow up and become a man, whereas a girl will realize I'm going to grow up and become a woman, that it remains the same. Also, in this particular stage, they tend to base their judgments about gender only on external characteristics alone, right? So for example, clothes, dressing, hairstyle, jewelry or no jewelry, these things are what they make their judgments, they base their judgments on. The final stage, which can begin anytime after 3 to 4 years, really, and it's not, there's no end point to it. So 7, sometimes even as late as 8 or 9 years of age also, is when they begin to realize that even if the external characteristics change or vary, the gender can remain the same. So for example, seeing a girl who's predominantly wearing, say, trousers, short hair, no earrings, they're not confused as to what her gender is, right? They begin to realize that yes, that element of constancy sets in, that this is a girl no matter what she wears, or this is a boy no matter whether his hair is long and he's wearing earrings or whatever. So that is kind of that's a concept that was put forth by Lawrence Kohlberg. So essentially, so now we've seen that from childhood until that all important phase of adolescence, so many various factors come at play, and they're all intermingling to sort of create this idea of what gender is. And this whole process come together is what socialization is. So children learn gender roles through socialization, the process by which they acquire all of these socially accepted standards. So whether it's typing, stereotypes, gender roles, all gender constancy, all of it comes under that umbrella term called socialization. Now, how do they acquire these standards of behavior? It could be by observing same-sex models. That's, a girl will try to emulate her behavior based on her mother. Boy will do the same to his father or to other same-sex adults that are around them. It could also be actively taught. Parents, teachers, neighbors could actively, there's direct teaching, isn't there? This is what you should do. No, you should not do this. So direct teaching, and sometimes indirect behavioral feedback as well. For example, a girl who may be very into playing outdoor sports and does not like dolls and ghar ghar and all of those games, and prefers to be very rough and tough with boys, may be told by those neighborhood aunties ki beta be like other girls na thoda, girls don't do this, why do you want to be in the sun so much? So indirect behavioral feedback. So all of these ways are how children gradually internalize gender related behavior, and with time they begin to realize that this is how I'm supposed to be, right? So again, family influences, cultural influences. Family influences can start as early as parental treatment of children. So within a family, boy and girl, siblings, brothers and sisters are treated so differently. I mean, I'm sure all of us have experienced that to some extent, right, in our homes, that some things girls are supposed to do, some things boys are supposed to do or not supposed to do. As sometimes parents, especially fathers, can be very uncomfortable if they see a boy playing with dolls, or a boy preferring to play these very girl based games. Sibling and peer influences also play a role, especially regarding playmates, right? So playmate preferences and kind of play is influenced more by siblings rather than by parents. Parents would be more about general dressing sense and talking and behavior and manners around the house. So family plays a major role from a very very young age. And then the cultural influences that we spoke about, television being a major source of of socialization, basically, or having these particular ideas thrust upon children, because life on television is so much more stereotyped than life in the real world, isn't it? Especially advertisements, I mean, where you have that typical family scene in an ad where the husband is reading the newspaper, the wife is so busy in the kitchen, the daughter is maybe, helping set the table or helping her, the boy is busy playing with cars on the floor. So this can get so subtly imprinted on the mind of young children. So obviously the number of hours that they spend in front of television is going to be directly proportionate to how gender typed they get, because they are very subtly and unconsciously, these images of what it is supposed to be like, or what it can be like, should be like, is imprinted upon their minds. Children's books also, for that matter, how male and female characters are depicted in books, where female characters are typically helpless, fragile, they need to be rescued. Male characters very brave, aggressive, the rescuer, so to speak. So all of these things come together and create these very strong ideas in the minds of children as to what I am supposed to grow up to be, or what I am supposed to do as I grow up. All of these factors come together until the child comes to the all important phase of adolescence. So adolescence, again, is this very turbulent stage, a very turbulent phase in the life of an individual, isn't it? And now we have this a psychologist called Erik Erikson, who divided the entire lifespan into these developmental stages, right from birth until death. And he postulated that each stage has certain conflicts which need to be resolved until this individual can make the transition to the next phase of life. In the phase of adolescence, what he has postulated is that the conflict is between establishing a stable identity versus identity confusion or role confusion. So Erickson says that the chief task during adolescence is to resolve this identity confusion, so that this adolescent can make the transition to adulthood, and become an adult who has a strong sense of self, having a valued role in society. So he needs to sort of resolve this particular conflict or this particular role confusion that is there. Now, to an extent, identity confusion is normal in adolescence, isn't it? Because adolescence is a phase of so much change. There is change in, physiological changes take place with respect to hormones, with respect to secondary sexual characteristics setting in, reproductive organs, mood swings, so there are just, and along with this sense of identity confusion itself. So all of these changes create these very unstable period, isn't it? A lot of unstable behavior can be seen in adolescence, ranging from impulsivity, anger outbursts, mood swings, to sometimes that terrible need to just fit in, being very intolerant of differences. They could regress into childishness sometimes, or behave overly mature for their age sometimes. So all of this turbulence can, to some extent, it is physiological. The biological changes that take place. To some extent, it is this kind of identity confusion that is going on also. So how does identity form then? When I say that an adolescent needs to make that transition, resolve the identity confusion, what am I talking about? Largely, there are three major issues in this particular phase in any individual's life. First is choice of occupation. So future, career, studies, what am I going to do? Who am I going to be when I grow up? Second, adopting a set of values and principles to believe in, that the individual feels he can spend the rest of his life living by those principles and values. Thirdly, is development of a satisfying sexual identity. So these three are the main areas that need to be sort of settled, stabilized, before this child or this adolescent can make that smooth transition into adulthood. What is sexual orientation now? Sexual orientation, so we spoke about what gender identity was, which was more of a feeling of maleness and femaleness. Sexual orientation, on the other hand, refers to an individual's enduring physical and emotional attraction. So I'm going to spend some time here. It has to be enduring, which means it has to be sustained. No fleeting attractions, fleeting moments of intimacy, that does not qualify as sexual orientation. Enduring, chronic, sustained over time, physical and emotional attraction. So not just feeling a sense of closeness, feeling that, oh, I really have, I have this bond with this friend of mine. Am I sexually attracted to her? So emotional attraction and physical attraction as well, right? So I'm repeating it. It's an individual's enduring physical and emotional attraction to persons of the opposite sex. The person is referred to as heterosexual. Same sex, it's a homosexual orientation. To both the sexes, which is referred to as bisexual, or to neither sex, which is referred to as asexual. So some of these attractions, some of these feelings are obviously present in childhood, but they become more and more predominant during adolescence. They come to the forefront, so to speak. Also, what plays a major role in sort of expressing this sexual orientation either which ways is again culture, right? The social context, the kind of cultural norms that we live in. So for example, there are certain islands in the South Pacific where homosexuality is common, it's acceptable, so that much confusion is not there in the minds of adolescents. They feel it's fine whether it's heterosexual, homosexual, doesn't matter, right? So social stigma also plays a major role in how much confusion, stigma, taboo is associated with having a sexual orientation that differs from the norm. Again, a large number of adolescents are unsure of their sexual orientation, which is again a part of the identity confusion that has been described. So I'll talk about this case that this client that I had who come to me in OPD. She's not an adolescent also. She's like 25 or 26 years old, doing well in her job. She came to me with depressive symptoms. I mean, the main reason for coming to me about a year ago was depressive symptoms. Family conflicts were there, not doing well at the workplace, and lots of emotional distress was there. So she's been doing well now with a combination of medications, therapy. She's doing well, stable, able to perform well at her job, recently got a promotion. Things are going well now. About a month ago, she confided to me that she was not sure whether she's straight or gay. So I asked her, okay, why do you think that? Why did this conflict come to your mind? She said, no, I have this friend who's been very close to me, a female friend. We've been friends for the last 2 to 3 years. But in the last year or so, I feel like I constantly want to talk to her. I want to share whatever happens in my life. If I have some problems at work or at home, I just feel that I need to tell her. If I tell her, all will be well. So I'm not sure, so I just seem to want her support, need her support all the time. So then maybe that means I'm lesbian. So I said, okay, do you feel any physical intimacy for her? So first I asked her, how long has this been going for? Enduring, right? That part of the definition. She said, no, about a year or so now. So fair enough, adequate number of time. Then I then asked her, do you feel any physical intimacy? Do you feel any physical attraction? So would you feel the need, or you sometimes feel that along with speaking to her, you would also want to be physically intimate with her? And she said, no, not really. I've not really, that is not a part of how I think about her, or those feelings have never entered my mind that I would like to be physically intimate with her. But I'm just worried because I feel like I depend on her so much emotionally. So you see this. So what I told her was that, so yes, so right now, as of now, I would not say that your sexual orientation is homosexual, because for that to happen, there has to be an enduring physical and emotional attraction. So possibly it could be one of two things. I told her it could be that because you've been going through a period of depression, emotional disturbance, she has been that rock solid source of support for you. You've been able to confide in her. She's giving you good advice. So you're depending more and more on her. That could be one explanation. The second explanation is, who knows, maybe in time you could experience physical attraction towards her as well. There could be a moment when you would want physical intimacy with her also. Either which ways, let's not label anything right now. Give it time, continue your relationship with her, and see. It could either just continue to be a very beautiful friendship that you'll take with you for the rest of your life, or if at all the physical component of attraction enters in, then yes, you could probably have a very satisfying physical and emotional relationship for the rest of your life. So you see, this is what I mean by confusion. That and she's 25, so she's not even an adolescent. So in that age of 18 and 19, definitely many adolescents are possibly unsure of their orientation as well. Now, what have been some of the explanations of homosexuality that have been given for the last few decades, we can say? Having a disturbed relationship with parents, lot of conflicts, too strict upbringing, too liberal upbringing, imitating homosexual parents or any homosexual adults that you know around you. Now, all of these have absolutely been scientifically discredited. None of these things are a root cause for what any person's sexual orientation is. Just as these cannot determine whether be the cause of heterosexual orientation, similarly they cannot be the cause for a homosexual orientation either. Again, a lot of adolescents many a times have or do try and engage or experiment with physical intimacy with members of the same sex, right? These are fleeting experiences. But again, I want to repeat that such isolated experiences or purely having homosexual fantasies does not determine sexual orientation, right? So the risk of repeating myself, enduring physical and emotional attraction towards members of whichever sex, as previously discussed. All right. So again, so what are the causes then? If it's not all of these things like relationship with parents and things like that, what are then some of the causes, or what can explain how sexual orientation develops? So again, as with any trait, biological theories, sociocultural theories, isn't it? What are some of the biological theories now about sexual orientation? So these days, lately, a lot of studies have been done, right, about this, because previously people didn't really, I mean, it's gaining more attention now, isn't it? So a lot of research is happening on sexual orientation. What could be some of the underlying causes? So finally, what people have confirmed to an extent is that it is a complex interplay of prenatal processes. So what is prenatal? Prenatal means before birth, in utero. So there are lots of things that happen in utero itself, which can later go on to determine what that individual's sexual orientation might be. There could be hormonal factors involved. So, for example, studies were done which showed that if the intrauterine levels of sex hormones in the fetus, and the fetus can be of either sex, it doesn't matter if it's a biological male or a biological female baby, but if the levels of sex hormones in this fetus between the second and fifth month of pregnancy are in the typical female range, this person is likely to be attracted to males in puberty, and vice versa. That if the hormones are in the typical male range, then this person is likely to be attracted to females in puberty. So this is how they say that hormone surges can play a role in what the sexual orientation will go on to be. Another such study actually was done where they assessed the level of the effect of testosterone on the developing brain and body, for that matter, of male babies. Right. So testosterone is secreted by the testes. Testes are the male sexual organs. So in male babies, biologically male babies, there is this little surge of testosterone that happens around the last week of pregnancy and the first week of life. So that small perinatal period, in that period they saw that if testosterone is secreted in adequate amounts in that particular period, it has a major organizing role on the brain and the body of this particular male child. So what it does in a way is that it sensitizes the brain and the body, so that when in puberty there is that second surge of testosterone happens in puberty, not only does the body development take place, but behaviorally also that child begins to feel male. So what happens is that the gender identity and the biological sex are seen to be in sync if in that critical perinatal period the testosterone secretion takes place. They also studied that in those male babies, biologically male babies, if in that critical perinatal period the testosterone secretion does not happen or it is inadequate, then this these children in puberty, when there is that accompanying surge of testosterone, there is asynchrony between the biological development and the behavioral development of the gender identity development. So these children could likely go on and be transgender. Right? So it's a very interesting study actually, with a small sample size, but it's an interesting concept, right? How hormones do play a role. So there is a definite biological basis. Another study was done which studied anatomical differences between the brains of homosexual and heterosexual men. They studied each aspect of the brain basically, and the hypothalamus, which is an area that governs sexual behavior, among other things. It governs lots of other things also, but sexual behavior is one of them. They saw that there were differences in hypothalamus size between homosexual and in the brains of homosexual and heterosexual men. So structural differences also are there, hormonal differences, structural differences are there. And then twin studies also have been undertaken to look for whether there is a genetic basis, whether you can isolate any one gene that could be responsible for sexual orientation. So now what are twin studies, right? Twin studies are, oh, I'm so sorry. Where did I go? Yeah, okay. So twin studies now are studies basically which are done for any trait. If you want to establish a particular trait as having more of a genetic basis or more of a socio-cultural basis, you do twin studies. What they do is that they study identical twins and fraternal twins. So monozygotic means identical twins who share the exact same gene pool, right? Same genetic, same DNA in both of them. Fraternal twins are the dizygotic ones who share the same kind of genes that any siblings would, like non-twins, normal siblings. So when they do comparisons between these two, it's a useful way of understanding how much of the particular trait in question has a genetic basis, how much has a socio-cultural or environmental basis, basically. So when twin studies were done, what they saw is that when they studied pairs of identical twins where one of the twin was had a homosexual orientation, they saw that the probability of the other twin also developing to have homosexual orientation is 50%. Now 50% is a very significant number, right? Similarly, when they did the same study in a set of fraternal twins, they saw that the probability of the second twin being homosexual is 20% now. So it has dropped, you see. They took it one step further and studied adopted siblings. So the adopted sibling of somebody who is homosexual, that the probability that that adopted sibling will also have a homosexual orientation was less than 10%. So you see, as the genetic pool becomes more diverse, the probability drops. That means that there is definitely at least partly a genetic genes do play a role in the development of sexual orientation. Now, they have not been able to locate any one gene, but yes, it is on certain areas in the X chromosome. They've sort of narrowed it down that there are these certain areas, a group of genes that can be responsible for this. So, a lot of groundbreaking research actually happening now. But again, now whether this is sexual orientation is decisively shaped before birth or at an early age is quite controversial, isn't it? So whether biology is all that there is, that culture plays no role, no, right? How much of a role culture plays, how much of a role biology plays is you can't predict basically which comes where. But this much is certain that definitely there is a biological basis for sexual orientation also. Now, there are two other studies that I just thought to include because they're again very interesting. Small studies, of course, especially this one, where what they did is it's very limited population, just 90 people they studied, which assessed the difference in brain architecture and activity among heterosexual male and females and homosexual males and females, right? So brain structure and brain function. Now, in brain structure, what did they see? They conducted MRI scans, and heterosexual males generally have, so straight men, informal words for ease of understanding, heterosexual males generally have asymmetrical brains, right? So generally the right hemisphere tends to be slightly larger than the left hemisphere. Interestingly enough, this same asymmetry was seen in homosexual female brains, whereas heterosexual females, straight women, have completely symmetrical brains, right? Left hemispheres are exactly the same in size, and the same variation was seen in homosexual males. So then they went one step further and said, let us look for activity now. Are there any differences in amygdala connections, right? So they did PET scans for this. Now, what is an amygdala? Amygdala is basically this area of the brain that mediates fear responses, impulsivity. So emotional responses and impulses are basically mediated by this amygdala, and it has widespread connections to the rest of the brain. So doing PET scans, they wanted to assess the blood flow and the connectivity between amygdala and other regions of the brain, again in heterosexual males and females vis-a-vis homosexual males and females. Again, what they saw here was that the amygdala connections were very similar between heterosexual men and homosexual women, and heterosexual females and homosexual men. So, this study, therefore, essentially what does it demonstrate? That homosexuals of both the sexes have a strong cross-sex shift in brain structure and function. So again, it points to the fact that there is definite biological basis for this, right? If there is, maybe this also then, these connections that mediate your fear response, mediate anxiety, can also then go on to mediate sexual orientation because of that cross-sex shift that is there. Another study was done which assessed the response to rating the attractiveness of male and female faces. So this is more subjective, isn't it? That was more objective, the data, the first study. Second study is more subjective. So pictures of men and women were shown to various subjects. And again, what was noticed is that viewing a female face produced a very strong reaction in the region of the brain called the thalamus in heterosexual men, homosexual women, whereas viewing male faces produced a strong reaction in homosexual men and heterosexual women. So, all of these studies are just showing more and more how biology plays a very, very important role, doesn't it? There is a social psychologist, I mean, was a social psychologist called Daryl Byrne, who postulated that the influence of biological factors, so biological factors do play a role, do influence sexual orientation. This can also be mediated by experiences in childhood. So, this is what I mean, not only biology, plus experiences, socio-cultural traditions, etc. All of that come together, right? So, in a group of homosexual men and women, when they took a back history of their childhood, most of them reported gender non-conformity during childhood years. So, what does gender conforming behavior mean? So, when children are attracted to activities commonly enjoyed by children of the same gender, that is said to be gender conforming behavior. And when they're attracted to activities or behavior or dressing or everything as children of the opposite gender, that is said to be gender non-conforming, right? So what we can call, when we say a girl is a tomboy, or look at her, she's a tomboy, only wants to play with boys, only wants to play with trucks and trains, does not want to wear dresses or clothes, that would be gender non-conforming behavior for that particular little girl. So these non-conforming children now, they will obviously feel different from children of their own sex, because even at the age of 6, 7, 8, if that difference is felt, right? Children do make that difference known. They won't include that girl in their groups. They'll have their little own cliques like that. So they start feeling different from children of their own sex. So this girl might feel that, why am I so different from all those girls? Why don't I feel that way? So this feeling of difference evokes a sense of psychological arousal. So feelings like sadness, anger, frustration, confusion. What is wrong with me? Why am I not like that? And later on in puberty, this can get transformed into a sexual arousal. So adolescents become sexually attracted to the gender that they see as different. So you see, traditionally, what we call homosexual orientation, gay, lesbian, is when I, as a woman, am biologically a woman, I feel like a woman, and I'm sexually attracted to other women. In this particular example that Daryl Byrne studied, these are women, biologically women, who feel male and are attracted to other women as a male would be to a woman. Transgender, right? That's where the difference comes in. It's an important, small difference, but an important difference. So these adolescents are not sexually attracted to a gender that they feel is same as theirs, but in fact to a gender that they feel is different from theirs. But you see, but the biological sex plays the role. This is how they're different from your traditional homosexual orientations, basically. So there has been a widespread model which has been given for the development of gay and lesbian sexual identity in terms of sort of like a time frame. For it's postulated as to around what age would certain behaviors or tendencies start to be expressed or start to be manifested. So it is said that possibly awareness of same-sex attraction can start between the ages of 8 to 11, followed by same-sex sexual behaviors around 12 to 15 years of age. They might identify strongly as gay or lesbian around the age of 15 to 18. Possibly disclosure can come in the late teen years of 17 to 19, followed by development of a same-sex relationship, which could be between the ages of 18 to 20. Now, of course, this particular model or this particular timeline will not accurately reflect experiences of every gay person, right? So it can, and in fact, there are some very noticeable differences between the timeline of women and men in general. So whether bisexual women or lesbian women, the sexual identity development is generally slower, because overall sexual identity itself gets established in women slightly later than in men. So in any case, for them, the timeline would be slightly delayed compared to homosexual men or bisexual men. Again, culture plays a very strong role here, right? So specific traditional communities, cultures which have very religious, very rigid beliefs or strong religious beliefs, very strong fixed gender roles. Children and adolescents belonging to these communities also may not necessarily follow that particular timeline or that particular model. Now, for example, cultures where there are very rigid gender roles, right? So this is a US study which studied Latin American boys or Hispanic boys, wherein in that culture gender roles are so fixed, right? A man is supposed to behave like this, a boy child is supposed to, do this, do that. There's very, very, very fixed, very, very deeply entrenched gender roles in the minds of that particular community. So it was seen that these Latin American boys tend to have an earlier awareness of same sex orientation as compared to boys of the same age but belonging to a different racial background, because they learn very early on that I'm not like all these other boys around me, or I'm not like what my father and mother expect me to be. I don't like those things, I don't want to be that way. So they learn it much earlier because around them it is so fixed, right? It's so fixed, it's so these roles are so rigidly enforced and believed basically by the community around them. Similarly, a group of Asian American adolescent boys were studied, who first reported male to male sexual encounters as late as 3 years later than other boys of the same age, but again, different racial background. Again, Asian American community, essentially in Asian culture itself, we have stronger emphasis on having a family, marriage, delaying the first sexual intercourse until at least adulthood, better still until marriage itself. So, because of these strong cultural pressures, the initiation of sexual relationships itself is later amongst Asian American boys, and then one step later would be male to male sexual relations. So these are all the different ways how culture can influence how how this particular sexual orientation or gender identity will be expressed, how it will be expressed, and for that matter when it will be expressed as well. um, so I think, okay, so with this what we have done is we have spoken about how gender develops. It starts with a sense of self, then gender identity. From there it goes on to sexual orientation in adolescence. We have again seen that as with any human trait or any biological trait, the debate of nature versus nurture is very evident in with respect to sexuality as well, wherein nature, that is biology, does play a major role. And I mean, studies are still in their nascent stages. We will probably get more research, more data as time goes by, giving a more fixed a place for biology itself, right? Or for your DNA, or for a very genetic makeup influencing sexual orientation. But also not to discount the role that culture can play. Culture, psychosocial interventions can also play a major role in the development of sexual orientation. We have insufficient data right now. How much each contributes is not known, but it's definitely a complex interplay of both factors. So with this, I think we move to our second part of our presentation, which would
Dr.
be,
Anagha, can I say something?
yeah, yes,
Okay, so I would like to add one thing wherein
yes,
when I teach socialization, I refer the Sigmund Freud, who has proposed his theory of
absolutely,
psychosexual development.
yes,
He described about the oral phase, anal
yes,
phase, phallic phase, latency phase, and genital phase as
absolutely,
the landmark steps, I think, for psychosexual development. Is that right?
absolutely, absolutely, absolutely,
Yeah.
absolutely,
Okay. So that is also the part of this
yes.
developmental perspective.
Yes, 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 yes. Freud also has contributed a great deal to psychosexual development. In fact, he has even gone a step further and described how that could play a role in the development of major mental disorders as well
Yes.
later on, whether it is anxiety or, I mean, of course, he referred more to neurotic illnesses at that time, anxiety, depression, etc. But yes, his basis was, I mean, he did deeply entrenched in psychosexual development and all the different
True.
phases.
Yeah. Please carry on.
Yeah.
Thank you.
All right. So dealing with family members now, isn't it? So family, I think, is an important institution. It's an ancient institution in India. Plays prime importance, I think, in India. I mean, in the Eastern world in general. We are born into the family. Generally and ideally, our families should be a source of great strength, love, comfort. They provide us with a sense of belonging, stability. We feel incomplete without a family, isn't it? So now, why is family so important, or why where do these bonds come from, right? Where do these emotional bonds arise between children and their parents, infants and adults? So this a terminology called attachment patterns or attachment was studied by Mary Ainsworth and John Bowlby independently as in the 1950s. And Mary Ainsworth defined attachment as a reciprocal enduring tie between the infant and the caregiver, each of whom contributes to the quality of the relationship. Right. So this attachment, she said, was important because it ensures that the psychosocial and the physical needs of the infant are met. So, how does this attachment develop? What are the types of attachment, and why is attachment so important? So she devised this situation. It's a lab-based technique called a strange situation, which was used to assess the attachment patterns between an infant and an adult. Now, the infant, the adult here is typically the mother, whereas the infant is generally between 10 months to 24 months, so up to 2 years of age. Now, what is this strange situation? It's basically a series of situations, all of which lasting for less than half an hour, wherein, for example, the mother and the child are first in an unfamiliar room. Then the mother leaves for a while. Then she returns with a stranger. Then both leave. Then only the stranger returns, and then after a while the mother returns again. So these are certain sequential situations that were that were artificially created only. It's a lab based technique, as I said. And in this, what was stressed upon more was the child's reaction. Right, each time the mother leaves, the mother comes, and specifically how the child reacts and responds to the mother's return. When the mother leaves, is also assessed, but more importantly is when the mother returns, how does the child react? So the child's responses were what were recorded, and based on these responses, she postulated that there are four main patterns of attachments. Secure attachment, which is the most common kind, and more than 60 to 70% of infant caregiver relationships are of the secure attachment kind. Two forms of insecure kind of attachments, which she described as avoidant and ambivalent attachment, and a fourth kind, which was disorganized attachment. uh, so a little bit about each of these kinds of attachment. Secure attachment, in babies who are securely attached, in this strange situation, the baby cries and protests when the mother leaves. But when the mother comes back, this baby very happily greets her, wants to be held by her. And in this particular secure attachment model, the mother is generally seen to be very supportive, very direct, giving, responding consistently to the infant's needs. So this, as I said, was the most common kind of attachment pattern that has been studied. Amongst the insecure attachments, the avoidant kind of attachment was seen in babies who did not really cry much when the mother left. It did not appear to matter to them much when the mother came back either. They did not tend to actively seek out the mother when the stranger was around, or they did not go to her for a sense of security or anything, right? So these children also, when they grow up, they are often they have these feelings of rejection, emotional isolation, abandonment. They're generally stressed, scared in unfamiliar situations. The mother figure here is generally very dismissive, distant, negligent about the child's needs, could also be overtly critical, irritable. The other kind of insecure attachment is the ambivalent one. Now, here, the baby in the strange situation may cry when the mother leaves, but quickly calm himself or herself down after a while. When the mother comes back, initially the baby will want to be held by the mother, but then was seen to kick and squirm and want to move away from the mother. So this kind of ambivalent responses was seen in the infant. The mother figure here again is often was seen to be inconsistent in her responses, indifferent, either overtly sensitive or insensitive towards the child. And these children, as they grow up, were again seen to be more stressed, angry. Again, the feelings of abandonment were there, more prone to having anger impulses, being generally aggressive in nature. And lastly, the disorganized attachment, where, I mean, as the name suggests, in the strange situation, also the child just had a very disorganized response. These children generally are seen to reach out to the stranger first, rather than the mother as a source of comfort. When they grow up, also they generally are very passive. They have lower self-esteem. They may tend to act out angrily and have these emotional outbursts as well. The mothers generally are ones who inspire fear, aggressive, unpredictable, usually suffering from a major mental health disorder or drug addicts or things. So now, why is this important? Why have I gone into the details of attachment and what all of it means? Basically, it's important for us from the point of view of that the security of this attachment in infancy and childhood is seen to affect the emotional, social, and cognitive competence of the child as he or she grows up. So, what children in a secure attachment who've been raised with a secure attachment feel is that they feel they have that secure base that they can return to. So, they are more confident to venture out. So, it's a paradox actually, but they are more confident to venture out, they're more independent because they know that they have something to fall back on, right? So the more secure the attachment, the easier it is for the child in fact to become more self-reliant and become more independent. And that is because a secure attachment reflects trust, right? Not only is there trust in the caregiver, but also children tend to trust their own ability to get what they need. So trust works both ways. They trust themselves and they trust the caregiver as well. So that kind of attachment in early infancy plays a major role in the overall emotional development of the child as he or she grows up. In our context of sexuality and sexual orientation that we're discussing today, it can also affect the outcome of coming out. So, coming out is a term we use in here quite often, don't we? It is the process of openly disclosing a homosexual orientation or a sexual orientation that varies from the norm, basically. So, in those who have had a secure attachment, when the child discloses his or her homosexual orientation, the parents are shaken, shocked, definitely. But the relationship is not undone. Somewhere that bond remains. It can be rebuilt, right? Even though it's shaken. In insecure attachment patterns, the reactions can be very violent, they can be very extreme, prolonged negative attitudes are held, a lot of resentment is held, and ultimately the relationship can sometimes be broken or it can come undone. So that is how attachment can sort of be connected or can play a role in terms of what we are discussing today as well, in our context today as well. So let's come to what can all the various parental reactions be, right? So once a child comes out and discloses his or her homosexual orientation to the parents, what are all the different things that parents can react. So the parents, I think to most parents, it would come as an extreme shock initially. Possibly there would be initial reactions of anger, anxiety, denial. This could then later on grow into feelings of shame or guilt. So, parents can feel, sometimes they think it's a personal failure. They think, oh, I went wrong in my upbringing of the child. They feel shame. What will society say? There's such a stigma. How am I supposed to hold my head up in society? So, all of these reactions have their root in ignorance, fear, misconception about genders, all of that, stereotypes and gender typing has occurred to them also in their own childhood. So they also have such fixed and entrenched ideas about what each gender role should be. And so all of these negative reactions generally stem from most commonly ignorance, of fear of the unknown. So first you don't know about it, then you fear the unknown because it's different from the norm, and then of course social stigma also plays a major role, right, in their reactions. So again, their reactions can range from outright rejection to acceptance, or somewhere in between. They could be dismissive, by saying, "Ki, theek hai, okay, you may feel this way, but let's not tell anybody else." Or why are you making your life so complicated? Forget about all this, na kya sexual orientation, or go abroad. Best, we don't have any relatives there. There you go, do what you want to do. Like, no problem. We'll manage here. Tum udhar chale jao. Very dismissive attitude, no? Or partial acceptance that, okay, what you're saying, maybe, but maybe it's a phase, let's hope it passes. Or get married, get married, all your problems will be solved. Or of course outright rejection, this is how abnormal, this is completely against nature, typical statements, right? Disowning the child, or you brought such shame upon our family, etc. Some parents might even give a reserved response, so neither acceptance nor rejection, more of avoidance sort of the topic. So just pretend that this discussion has never happened, try and distract and just try and prevent this topic from ever being discussed again, for that matter, and just hope that the child will forget about his or her sexual orientation. Acceptance of course can happen. I think it's very, very rare that acceptance will come as the first response of parents. But in due course of time, yes, definitely they can learn to accept that this is. I mean, from parents' point of view, they may consider it's a natural variant, of the norm, which is an acceptance of some sort, at least for us. So these are the way all this is the way basically all the different reactions can come. But let's come to how parents should react, right? So what can parents do, or what would be the ideal way of reacting? So now, if your child has in fact voluntarily come to you, if your child has shared or has come out to you voluntarily, I think the two most important things to do is, first, do not, reserve judgments. Reserve judgments. Do not pass your opinion immediately. Try and tamp down that reflex response that will come of, what, that, no, impossible, not possible, rubbish, no. So try and control that initial response or that reflex. Do not pass judgment immediately. Don't even give your opinion immediately. Just hear out the child. Once you finish hearing out the child, I think it's very, very important to thank the child for disclosing this important aspect of his or her life to you, because it's not easy. It's not easy to speak about something that is so deeply personal, deeply private. It takes a lot of courage. So thank the child for trusting you enough to come to you with this. The next step could be to ask, how did he or she come to this conclusion? Okay, how do you know? Why do you feel this way? Have you, spoken to somebody about this? Do you have any information on this? Ask to share that information with you. If they have approached counselors or professionals for help, ask if you can go speak to those people as well. So try and get as much information as possible as you can about your child's state of mind, how and why he or she has come to this conclusion, and how can you understand also, right? So that would sort of be that would be a signal of support to the child, that at least you want to understand. You may not understand right now, but you want to know more about this. Many times children may not directly come out, so they may introduce this topic as a narrative or as a third person story, that there's a friend of mine who went and told her parents that she thinks she's attracted to another woman, or I read this in a magazine, or I read this on the internet. So many times children use this as a way of testing the water, so to speak, to see how are my parents going to react. Should I come out with my own orientation after this or not? So if your child in that ever comes to you with such kind of a story, always, again, don't be judgmental at that time. Don't pass judgment, don't give opinions. If you can't say anything supportive, you can at least say that, okay, maybe I don't know much about this, I don't know, I don't want to comment because I really don't have enough information, so I don't know, but I guess it's fine, it's his or her choice. So give very neutral, non-committal answers. Do not be very judgmental, so don't scare your child away from coming out to you with their own with their own orientation as well. Again, as we've discussed previously, the child could simply be confused about his or her sexuality, right? He may not be sure, maybe coming to you in that confusion. So rather than isolating the child by being negative, again, you can consider taking professional help. If the child has not already sought professional help, you can speak to any LGBTQI aware psychiatrist, psychologist, school counselors, anybody, right? Anybody who is professionally trained to understand these issues and guide you through them. Again, you can ask the child if he or she wants to go on her own, if you want to go initially first, or everybody go together as a family. There are so many ways that this can be handled. So at the end of the day, all that the child wants is reassurance. Many a times, these children, or these adolescents, or even young adults, are themselves feeling scared about how to tell you, what will my parents say. They have their own set of negativity that they're dealing with. So all that they really require from us as parents is a sign of reassurance that we're there for you. Okay, fine, you're going through this phase or whatever, I don't understand, you have come to me with this, and I will try and support you in what way I can. I accept you for who you are, and I'm not going to force any of my beliefs or my belief system or my thoughts onto you. So just reassurance and warmth is all that the children are really looking for from us. So just as parents, how parents should react, there is obviously a list of how parents should not react. So, threats. So many times we have these families in OPD where, they just, nahi, I'm going to disown my child, or abandoning them, throwing them out of the house, cutting them off from the rest of the family, forcing into marriage, saying that, no, you get married and that's the answer to all this. And then you don't have to, all this will change after you marry, or if they're younger children, then this is the age to focus on studies. You're not supposed to focus on all these things. So agreed, studies are there, but what if studies got to do with sexual orientation, right? And now it is, fortunately, unfortunately, all these things develop around that age only. When you're 18, 19, or rather 16, 17, 18, 19 is when these feelings come to the forefront anyway. So yes, focus on studies, but that does not mean that you ought not to focus on your orientation. um, this is something that I feel very strongly about, consulting quacks to try and cure the child. Because again, so many times parents come to us in OPD and they say, that I suspect this about my child, or my child has come out to us, and you have to do something and cure them of this idea. You give some medicines, everything is fine. And then I have to tell them it's not an illness. So where does the question of cure even arise? It's not a disorder, it's not an illness, it's simply a way of life. So all of you are going to need to find a way to live with it. And then when they obviously face rejection from the medical community, or the medical and paramedical community, then they go to all these faith healers and quacks. And then there are some really some methods that are used can really harm the child, can really traumatize the child. So please, no quacks, no cures, no miracles are going to change anything really. Another way that parents cope is, saying, blaming your friends ki bas ye that was the group, you've joined that group, और तभी से सब शुरू हुआ है. So this is all to do with these friends and these forward thinkers, and simply you're on social media all day and you're simply getting all this information, and now you are declaring that you have homosexual orientation. It's all because of your peers and friends. No, it's not. Now we know now what it is because of, and what it is not because of, for that matter. So just as it is important for us to focus on how parents should or should not react, I think it's also important for the LGBTQI community, for the youths in this community, to think of some points for themselves when they approach their parents, or when they come out or disclose their sexual identity orientation. I would advise all of them to give parents and family members time and space. It is a major news that you're breaking to them. It is going to be something that is going to shock your parents, that is going to maybe shake them a little bit. They'll be anxious, they'll be worried for you, your future. So give them some time. Give them time to process this information. Acceptance does not come naturally. Nobody can be 100% accepting from the word go, right? So keep the channels of communication open from your side. If you're telling them something, don't get defensive. Many a times what happens when parents give this negative reaction, our young adults tend to get very defensive and say, oh, you don't understand me, and I don't want to talk about this anymore. No, let them have their reaction, but from your side, try and keep the channel of communication open. Share educational resources. Take them to any therapists if you have been seeing any. If you've not been seeing any, all of you as a family unit can go in and get professional guidance, understanding about the subject, what it means. So continue speaking to them, continue giving your parents enough information so that they can gradually evolve, right? Their thought process can gradually settle, and they can come to your way of thinking. Maybe if they want to spend more time with LGBT people, you can create opportunities for them to understand them better, understand their lives better. And most importantly, it is that sexual orientation is just one part of life. So show them that it is not all that I am, right? You are not defined by your sexual orientation. You will be depending on your age group, be studying or having a job or working or doing, being successful as a painter, as an artist, as a doctor, engineer, lawyer, teacher, whatever it is, and have whatever sexual orientation that you have. So show them that I'm doing all of this and this, my life is happy and settled. And so, I'm not only going to be defined by who I am attracted to physically or sexually. Try not to fall for the whole self-pity rabbit hole that, I'm the victim, everybody is talking to me like this. It is going to happen. So you're going to have to increase your threshold a little bit to tolerate all these taunts and hints that may come, if not from immediate family, from the extended family. But try and increase your resilience to that, right? Try and remember that you are not at fault. You are not the victim of anything here. You absolutely have the freedom to choose to live your life and have whatever sexual orientation that you want to have. There is no so try not to fall down that trap of becoming a victim, and that everybody is against you, sort of a thing. Also, I think it's important for you to not be a victim again, is to know your rights, right? So read up about it, speak to lawyers, understand what your legal rights are, your medical rights are, your family inheritance rights are, because a lot of judgments are being passed. The law is changing nowadays, right? It's becoming more inclusive, slowly to be sure, but it is becoming slightly inclusive. So keep up to date with the knowledge. Again, now for all that I say that yes, keep the communication channels open, and increase your frustration tolerance. Don't be bothered by what they say, but this is to an extent. You need to draw a boundary, right? And remember that you are not responsible for your family members' actions or their thoughts or their emotions. So don't start feeling guilty that, oh, I have made this happen to them, they are so low now because of me. No, you have simply stated your identity, your wish to live in a particular way, and now it is up to them to accept it or not. So having those boundaries in line, remembering that you are not responsible for anybody's feelings, is again very very important. So keep that line in place, right? Try your level best to help them to understand, to help them to come to the path of acceptance, but not at the cost of your own mental health, not at the cost of your peace of mind. So that's an important distinction to make also. Again, acknowledge the problem, right? That yes, there's an issue, we have an issue. Don't magnify it, don't minimize it, don't try to go into denial and say, "Nahi, theek hai, it will solve itself on its own, let me not think about it, push it under the carpet." No, don't do any of that. Again, nothing has to be fixed or resolved in one day, right? Rome wasn't built in a day. Let time pass, let some time pass, let give it time for everybody to adjust to the new situation, so to speak, everybody in the family. As I said, try not to hold on to any resentment, any bitterness towards any of the family members. And again, do not let your sexual orientation define your entire life, right? I've mentioned this before. Carry on, have a clear plan for who you want to be, what you want to achieve, what sort of goals you have in your chosen career or profession. This is simply a part of your life, it does not define who you are. That is also a very important take home message, I think. Again, sometimes what happens is that in our LGBT support groups, we come across these clients who say that, yeah, parents are accepting, they accept, they've said ki, "theek hai, you have the freedom to live life your way, we're not going to impose our ideas on you." But then why don't they come and attend my meetings, or why don't they come and meet any of my LGBT friends, why don't they participate in pride walks? So they hold that against their parents. Now over here, I understand that you would want your parents to be entirely supportive in a very demonstrable manner as well. But I would suggest that understand the difference, that parents are accepting you as who you are, they are loving you unconditionally, they're giving you the freedom to do what you want to do. Give them some time, maybe. And maybe our parents can be, especially if you're from a conservative background, more orthodox, they may find it difficult to show any demonstrations of their acceptance, basically any public demonstrations or any obvious demonstrations. Don't hold it against them, is what I would say. Give them time. If they come around, great, that's a great bonus. But if they don't, try not to hold that against them, basically. Again, try to attain financial independence. It's the same thing as, as what I mentioned earlier. Now, financial independence is important for everybody, isn't it? Anybody, irrespective of sexual orientation. And that is how you need to look at it, that irrespective of my sexual orientation, I need to be in a position where I can be financially independent, so that I can live life on my own terms. Because in case of outright rejection, in case your parents have completely refused to accept you, you have let time pass, you have taken professional help, you have tried to speak to them in all possible ways, but no, they're not budging from their position. They've absolutely said that, "cut you off, we don't want to have anything to do with you, leave us." Then you should be in a position to build your own life. You should be in a position to stand on your own 2 feet. Now, of course, I don't mean this for younger children and adolescents, but those who have at a certain age have completed their education, etc. So always focus on that fact, focus on having an education, on having so that you can later on fend for yourself and live on your own, live independently, basically, if that need arises, and god forbid if that time ever comes. Again, if this lack of family acceptance persists and continues, you can always build what is called your second chance family, or family of choice. Now, who is this family of choice? Family of choice refers to those people who connect voluntarily through a sense of fellowship. So it's not your biological family, it's not your family of origin, but it could be friends, neighbors, other members of the LGBT community. It could even be some part of your biological family. Maybe your siblings are supportive, maybe cousins are supportive, uncle aunts are supportive. So build your own second chance family, keeping all these people together, right? Acknowledge that your family of origin right now is not accepting you, they're not able to come, they're not able to fulfill the role that a family is supposed to fulfill. But each and every person has the capacity to create your own family at any time. Widen your circle, treat them as family. You will get from them that sense of belonging, love, comfort, companionship, friendship from these families. So this family that you create can serve all the needs that your family of origin should ideally serve or had been serving until your coming out. Again, as I said, being from the LGBT community, you can face a lot of estrangement. It could be subtle, it could be direct, so it becomes natural then to bond with members of your own community. There are similar experiences, shared rejections are there, so that helps you come closer. It gives you, as I said, a sense of belonging. It makes you feel less deprived. It gives you that sense of support, the sense of security, that I have somebody that I can fall back on. There are people who are holding me up, so to speak. It can also help in the process of healing. Many a times, as time passes, you can get a different perspective on your family of origin. You may learn to let go of those resentments, of that old bitterness, and say that, okay, I have my family, I have these people, and this is my new family, this is my second chance family. Maybe I can just move on and let that rift just heal on its own without holding on to any bitterness about my family of origin. And this is far more empowering. It makes you feel more self-empowered because you can choose these family members, right? They are absolutely people that you choose to spend time with, people that you connect with emotionally, and on an emotional level. And of course, sometimes even your family of origin, your biological family, can become a family of second chances as well. So it can happen that with time, your family members, your parents, your siblings can accept you, can come around to you, and at that time they can again once more, become a part of your inner circle, or become a part of this second chance family that you have created for yourself. So, as Richard Bach says, the bond that links your true family is not one of blood, but of respect and joy in each other's life. With this, I'd like to conclude and thank you for listening to me very patiently. A list of references that I have added at Dr. Naidu's request. I have drawn most of my material from these books. Again, I would like to, I just would like to mention here that these books are not, curriculum material, or they're not necessarily written by experts or anything, but it's very good reference material to get more information, and for additional reading, to improve your understanding of the subject, definitely. So yeah, I think thank you all once again.
Thank you so much, Dr. Anagha. And for all of us here, I would like to add, when Dr. Anagha has mentioned about the parental support, we have invited one of the rainbow parent, that is Mrs. Aruna Desai, who is a co-founder of Swikar. She's going to take one of the sessions here in this certificate course, where she will help all of us to, I think, what Dr. Anagha has mentioned about the parental support. And she has already experienced when her son came out when he was 17 years old, and he came out and he said that, Mom, I'm gay. So her way of accepting his identity, her way of going and fighting with the society, family, and today she is not just the parent of one gay child, she is Aruna auntie for the big group from LGBTQIA plus community. So
Wonderful.
thank you so much, Anagha. And now the session is open for questions. So you can unmute yourself and ask questions directly to Dr. Anagha, or you can also put your question in the chat box.
I think there's already one
Yes.
question here from Manya.
Yes.
Yeah, so I think I'll just read it out. Should I just read it out? She's, I think, said, when we talk about acceptance from society, family, and friends, it's hard for them to accept the reality that if I belong to the LGBTQ plus community, and this may lead us to depression, we can have suicidal thoughts. Yes. How can one individual cope up? What is the advice one must follow? Because in that situation, we don't know what we're doing. Absolutely. No, you are quite right, Manya. Actually, I since my topic today was space, I think you have a session on mental health concerns amongst the LGBTQI community, wherein Dr. Kaustubh Zog may go into more details about this. But I would advise you that if you feel ever that, or for any of you rather, if you start feeling, don't wait until you have suicidal thoughts. You start feeling low chronically. You feel that you're just not interested in things that you used to be. You're crying all the time. Your sleep is disturbed. Appetite is disturbed. You're feeling helpless, hopeless. Seek professional help. Please, at that time, seek professional help. There are plenty of psychiatrists and counselors nowadays who are LGBTQIA sensitive, aware, and they can guide you well. I mean, I personally see a lot of clients from the community. And yes, you are right, depression is very common. Major depression as a clinical disorder is common, and which can definitely be addressed with a combination of medicines if required, and counseling as well. So please do seek professional help. Do not wait for that that last point of feeling like ending your life, or that it's not worth it. Every life is worth it. And absolutely seek professional help. And you can be helped. I mean, these thoughts can be overcome. You can be helped, as I said, with a combination of medicines and therapy. So always seek professional help. Anybody? Okay. Okay, I think Tisha Majumdar has asked, is there an equivalent to the Oedipus complex or Electra complex in terms of the same sex? If yes, what are they called? And can you please talk about it? I am not aware of any such, because this terminology was given by Freud, and it's I don't think there is anything, but let me find out. I mean, I think I am I as far as I know, there is no such term, or where did it go? And no such term, or no such explanation that has been given from a psychological or this thing point of view. But let me find out more about it. It's an interesting question, actually. If you want, you can just get my email address from Dr. Renu, and I can get back to you personally on this. Maybe I will definitely look into it though.
Yeah, I recall, I think Sigmund Freud has mentioned somewhere about Oedipus complex. She's
Yeah.
right. So even I do not have
Yeah, yeah,
idea.
it's a very interesting question, because I have never really even thought about it in that way. But I will look for it for certain, because it it's a nice perspective. It's quite interesting. So I think, ma'am, if you could just share her email address or something, Dr.
Definitely,
Renu, I think I can just once I have some information or some references, at least I can definitely pass them on, so that
definitely, Dr. Anagha. We'll
her
definitely
question
forward
will
this
be
question to you.
answered.
Yeah.
All right. So Saloni then, good afternoon, Saloni. Can you explain the biological theory in utero development for people who come out as asexuals? Yeah. So basically, you see, in the biological theory, what asexual population is very limited, right? There are very few people who are coming out as gender asexual. So even considering the proportion of people who are openly now homosexual or gay or lesbian, even with such a big population that is now open, the studies that I have mentioned literally have 90 people, 50 people in them. So asexuals, there is very limited data that is done exclusively on what can lead to the development of asexual gender identity. Any specific data, huh? So by and large, uh, 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 and I think it is related to a limited study population and a limited sample size, because most people either are not aware of being asexual. They just feel they have a lower sexual drive. Sometimes they feel maybe it's just low levels of hormones, because partly there could be a biological component to it, in terms of pituitary dysfunction and everything, where the levels of sex hormones itself are lower. But people who are in all, like, purely having asexual orientation, in terms of all hormone levels being normal and everything else being within the normal limits, and still they don't have attraction towards either men or women, it's a very small population. So I don't think those many studies have been done on them at all to come out with any conclusive data about that. Uh, Pradipta Chaudhary has asked me, being gay and living gay, the challenge lies in the gap. Absolutely. How to balance the gap with parental support system. So, with parental support system, I would think that that gap, it would be slightly easier to balance it, because what happens is when we say we want family support, many a times we feel that we always talk of the extended family as well. Now all of them supporting, coming around to your way of living is not going to be easy. But I think if you have your parents who are on your side, what you can show them to begin with to balance this gap is try and show that you can lead a happy, fulfilling, overall well-rounded life in terms of whether it's your career, your extracurricular activities, your hobbies, your socialization with friends. All of that is there, and you are very much the same son that you were before you disclosed your orientation to them or not. And that what your sexual orientation is really should not be anybody's problem, for that matter, shouldn't it? So as long as both of you and your parents can work out a system of what are they comfortable with. So you being gay, as you rightly said, is one thing. Living that way is another thing. What are some of the things that they are comfortable with, especially if you're living with your parents? You can maybe have a frank discussion about this, that okay, I know you have accepted me, so I'm assuming that they have accepted you, and they have sort of given you the freedom to live your life the way you want to. In that case, if you are living with them under one roof, what I would advise you is to have a frank discussion about what are some of the things that, when you say you accept me, to what extent is it? Is it just that yes, I'm free to do what I want as long as we don't hear about it? Or are you okay with me talking about my partners, my people that I'm romantically involved in? So just as I would have come home and said, oh, I have this girlfriend or somebody that I like, and you would have been happy for me, are you going to be equally happy and supportive if I come and tell you that there is I have a boyfriend, and we're happy and we're going out and we're dating? Or each time you leave the house and you tell them that I'm going to meet him, or I'm going out for dinner, are you going to be comfortable with that? So I think there is no one way or no right way to really balance this gap. It's all about what each party is comfortable with. So if they have, I think you've already, like, half the battle is won, because they are accepting you. They're already, I mean, compared to other members of the LGBT community, they're accepting you, they're open to you living life the way you want. Then when it comes down to the finer details, what I would advise you is to just have that frank discussion with them. Speak to them about this, and this is the way I would want to live. Are you comfortable with this? If not, if there are certain things they are not comfortable with, are you okay complying with that? If not, is there a feasible option for you to move out, live on your own for a while, so that everybody is happy, you meet each other at times, but your private life or sexual life is kept, is private, basically, is your own. So there are many ways of trying to bridge this gap, Percy. I mean, I hope that has answered your question, unless you had anything specific in mind, Pradipta. Okay, so can I go on then to Ransi Matthew? Is sexuality and sexual orientation having the same meaning? No. Sorry, it's just jumping down. No, it's not. So sexuality is a very broad term, right? Sexual orientation, as I said, specifically refers to attraction. Sexuality can include gender identity, sexual orientation, all of those things. So it is not exactly synonymous with each other. I think sexual orientation is a part of your overall sexuality, right? Sexuality is a more umbrella term, sexual orientation just being one part of it. Okay, so I seem to have answered Pradipta's question. Shiv Priya here now. Sigmund Freud used the term Oedipus complex in psychoanalytic theory. Yes, to describe. Yes. No, okay. I think she's explained. Acha, in response to the previous question, I think Shiv Priya, have you explained the Oedipus complex in response to the previous question, or is there a question there?
No, I think
I
she
think it's
Yes,
explained.
ma'am.
explained. Yeah.
Yes, ma'am. Actually, I explained the term that Oedipus complex is basically a medical term which was used by Sigmund Freud, and that he has also
Exactly.
mentioned in his psychoanalytical theory that I've explained.
Yeah.
Sorry, ma'am.
Yeah. All right. No, don't
And I
worry.
think there is a specific age, there is a specific phase
Yes.
wherein the child develop such attraction towards the
Exactly.
opposite sex parent. So that is what I'm not very sure about. What is
Exactly.
the
And it's
age?
not enduring. It's not
Yeah, it's
enduring.
not
According to
enduring.
me, this age, it should be around the age of 3. I think it's around 2 to 4 or 2 to 5 is probably the age when this
Yeah,
develops.
3 to 6 could, yeah,
Yeah,
3 to 6
yeah, and it is not
could be
enduring.
enough. Yeah, it's
So
not enduring.
I'm not sure how much. So it's just one of the steps for the child to understand what
Yes.
it means, what attraction means, what sexuality means, in his whole step-by-step theory, so to speak. But again, as far as same sex is concerned, I will. I'll look that
Yeah.
up. I'll look
Uh,
that
Thank
up.
you, Shiv.
y-
Thank you,
Ma'am,
Shiv. Yeah.
can I say
Yeah,
something?
sure.
Yes, ma'am, that's in the initial phase, primary phase of a child.
Mm-hmm.
Actually, Sigmund Freud has mentioned the three terms, id, ego, and superego,
Yeah,
where he
absolutely.
has talked about. Yes, ma'am. So it is that's on the primary phase of a
Correct.
early
Correct.
childhood.
Correct. Exactly. It's early childhood. No, it's not enduring. That's what it doesn't go
Okay.
on. Yeah, I think Rajiv has
Thank you.
raised his hand. Do you have a question, Rajiv Anand?
Yes, ma'am. So, ma'am, like when you talk of different studies,
Mm-hmm.
so in terms of like the development perspective that is used to understand one's identity,
Hmm.
for instance, like we know for gay people when they come out, so it's like for them their whole life starts again. Like
Yeah.
they have all the childish desires and nuances. Like
Correct.
their teenage is different, their adulthood is also different from
Absolutely.
compared to the cis population. So
Absolutely.
are there any studies that compare the like developmental growth of both like comparative study of cishet people versus gay people to see how after coming out it resembles kind of like living the life again, but at a different
Mm,
age and in a very different kind of world?
mm. No, I don't think there are any such specific studies. So, studies that have been done in the gay community, especially after coming out, definitely there are studies regarding the development of mental health problems. Because, as you said, na, they are how a person with a conflicting gender identity or gender non-conforming behavior, how that child processes the teenage years is very different from how a cisgender is going to process the teenage years. So they are more vulnerable definitely to to behavioral issues, to anxiety, to depression, etc., because they're struggling for so long, and most of it is under the surface. It can't be expressed, or they don't express it. So definitely there is a greater a vulnerability towards developing major mental health issues in teenage and childhood, in adolescence years, as well as later on in adulthood. But subjective experiences, so a comparison of subjective experiences after coming out, I don't think there is a comparative study. There is probably literature on where data is collected on how they feel, or post disclosure, what are all the emotional steps that they go through, or all the different changes that occur in their socialization, in their mental state. But I don't think there are any or not that I know of course. I don't know of any comparative studies that are done between cisgender versus gay or transgender, and how they process after coming out. Because you see, after coming out is also a variable term na, that can happen at any time. So it is pretty individual if it happens after. So coming out can happen 18, 19, 20, 25, as late as 30 years. Also there are people who don't have not really disclosed, or living like a dual life and all. So then at that age, comparing how their reactions are after disclosing, is I think it will be difficult to match a sample size. Is what I feel. If I think about it, it would be unless you're just going to match for age. So having matched for age and finding those who have disclosed at the same age, and then how they feel, I'm not sure there are too many studies actually on this, if that was what you meant, huh? Okay, it answers your question. Okay, 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 great. Wait, okay, run. See, Matthew, no, so sexual orientation need not always be, no. In fact, it is no, sexual orientation absolutely will not be determined, in fact, at the fetus stage. Nothing can be determined at that age. There are just tendencies, what may happen, may not happen, and what happens in a majority of people. You see, it is not conclusive, it is not a direct prediction. All of these hormonal studies and things now, as I said, very much in the nascent stage, and they're just finding some concurrence between what they have found here vis-a-vis when they took it in the long term, and they studied that same cohort of children in their adolescence, and then who were they attracted to at that time. So it absolutely does not 100% determine the sexual orientation. Sexual orientation is more is a term that specifically, even during adolescence, I would say it's very difficult to label unless somebody is very sure. So no, to answer your question, sexual orientation need not 100% be determined. In fact, it cannot 100% be determined at the fetal stage. Absolutely not. I think the earliest would probably be still teenage years, early teens maybe. Yeah, you're welcome. Anyone else?
All right, ma'am. I can't see any more questions in the chat box.
Yeah, neither can I.
If somebody wants to still unmute, you can go ahead.
Are we done?
Yes, ma'am. Just a second. Dr. Anagha, I would
Yes.
like to ask one question. Actually, sometime back, one student asked me about this. Is there any study or have you ever come across wherein a person only after marriage came and disclosed that no, after marriage only I realized that I am gay or I am lesbian?
Yes, it can happen. Unfortunately, it can happen because, as I mentioned in that study that they did, now that Asian American boys, that way they saw what happens is in our Asian community, there is a great emphasis on delaying sexual initiation, right? Where it could be now brought down through the generations or through the ages in our overall cultural makeup or whatever. But essentially, most, not, I mean, I won't say most, but a large number of young adults may not really ever engage in sexual intercourse until adulthood, some even until they are married, depending on the background, socio-cultural background, basically. So sadly and unfortunately, maybe this person could have been conflicted about their gender from beforehand, for sure. So I don't think it is entirely possible to be very gender conforming and then just after marriage, you suddenly realize that, oh, I'm gay. No, possibly this person may not have had sexual intercourse before, so may not exactly know to what degree he or she is attracted to males or females or to members of the same sex, because, as I said, if they've never had engaged in that kind of physical intimacy before. But according to me, gender non-conforming behavior, some confusion about identity, feeling different from other boys, definitely must have set in from at least late teenage years. So I'm sure there must have been some conflict. Now again, social stigma, cultural roles, may not have really been had the courage to come out, or may have gone through with parents forcing marriage, or these are things I'm supposed to do. Unfortunately, there are a lot of cases that way, who, I mean, here at least I would give benefit of doubt to that individual. Maybe he never had intercourse before, so may not have known. But there are people who absolutely know that they're LGBT, but still will go through marriage to a member of the opposite sex for parental pressures and things like that. So it does happen.
Thank you.
You're welcome.
I think we don't have more questions.
Yeah.
So I'll take this opportunity to thank you for firstly accepting our invitation, ma'am, and answering all the questions so patiently and kickstarting our aspect of the course wherein we deal with the psychosocial as well as social medical aspect of the issues that the community faces. So thank you so much for such an engaging session, ma'am.
Thank you.
It was a privilege to have you today.
Thank you. I was happy to be here. Happy to speak to all of you today.
Thank you
Thank
so
you for
much.
the opportunity.
Thank you very much, Dr. Anagha.
You're welcome. You're welcome. I'm happy to be here. Thank you for the opportunity.
Copy that question. Hmm.